is when there's an accidental entry of any substances other than air into the lung or the airway. So
Okay.
this can be food, it can be fluids, and what that does is that it causes irritation of the lungs, it causes irritation of the airway, and so it can lead to a pneumonia. So aspiration itself is a problem, and it can result in a pneumonia, which worsens the issue. The problem is that over the past year, we've seen a worrying number of children who come in with aspiration, many of them needing to be ventilated at the Paediatric Intensive Care Unit, meaning they need help to breathe, they need to be put on a machine. And unfortunately, some of these children die. And we know that the causes of aspiration are usually preventable. So if we know that we can prevent these causes and prevent aspiration from happening, then we know that we have a better outcome for our children. It's not, even though we are focusing on July as the time to create awareness, it's something that we want to keep on hammering on. It's a nationwide campaign. It's not just going to be limited to this month. It's continuous education that we need to keep on doing, because the children who come in with aspiration is usually from things like force feeding or accidental ingestion of substances that have been taken in, and then an adult to give them something like palm oil to try and get them to vomit and bring out the poisonous substance.
Oh.
Giving of palm oil is actually what usually causes worsening of the situation. So that's why we think it's important to raise awareness, to educate the public so that these children don't have to come into the hospital at all. Even though they might vomit after you've given them the palm oil, what happens is that whatever they've vomited and what the palm oil you've given them is going to go into their lungs, into the airway, and that is what is going to cause their breathing difficulty. So from what we've seen, a lot of the time, it's usually the toddlers. At that age, they are curious.
Okay.
They are trying to find out what's going on in the world around them.
Right.
And unfortunately, we may store certain substances like kerosene, bleach in bottles that are usually intended for drinking. So you might find a Belacqua bottle has kerosene in it.
Yeah.
A child is thirsty. They don't know the difference. They'll go and pick it up and start drinking it. And then you as a mother or father may notice it's what is going on. You give them palm oil. And then apart from the damage that may have been caused by the toxic substance, you also have the palm oil worsening it. And then you may have certain conditions. So for instance, in babies who are premature, they have difficulty coordinating swallowing and breathing sometimes, and the sucking. So these babies might be at increased risk of aspiration. And when they're admitted to the hospital, sometimes instead of letting them feed directly from the breast because of the difficulty with the coordination of these reflexes, we might either feed them by cup and spoon, which is easier for them to handle, or sometimes pass a tube through their nose or through their mouth so that it goes directly into their stomachs, and this decreases the risk of aspiration. And then mothers are taught how to feed their children properly so that there's a decreased risk of this happening. There are also some children who have neurologic conditions. So for instance, a child who has a condition like cerebral palsy may have difficulty with swallowing.
Okay.
If a mother doesn't take her time or a caregiver doesn't take their time when they are feeding them, it can lead to aspiration. So with all of these conditions, you have to know that there could be risk involved, and you know how to decrease the risk of aspiration occurring.
Medical officer from the Paediatric Intensive Care Unit at the Korle-Bu Teaching Hospital, Dr. Jemima Abugiri, stated that vomiting, choking whilst feeding, sweating, and change in color in babies are symptoms of aspiration.
So usually there's a history of maybe vomiting or you feeding, and then all of a sudden the person starts to choke.
Oh.
Then they start to have difficulty in breathing. Either they start breathing fast or they're unable to hold their breath. And they'll say, sometimes sweating, they're sweating a lot. If the baby is still, if it's still a baby and he's pink, you would start to see that his color may start to change. He may start to become darker. His lips will be becoming darker. We call it cyanosis. It means that the oxygen level in the blood is going down. Sometimes the person can even become unconscious because of the reduced oxygen levels in the body. So these are some of the things you can see at home that will make you think that or suspect that somebody is having an aspiration. The difference is that before the aspiration, there's always something that happened, maybe in relation to feeding or in relation to falling into water or something. The asthma is provoked by environmental triggers. So those who have allergies to smoke, dust, and all those things. But in our situation, we tend to find out that the aspiration, there's always, you started feeding the child, or they were feeding him, or he was eating, then right after that, then the aspiration happened. Because we said that aspiration is when something other than air goes into the lungs. Typically in our environment, that's always food, because either you're forced. And one of the things we find is that mothers are always trying to force their children because they think they're not eating enough. I've brought a whole cup of cocoa to you. You've taken 2 spoons. Sometimes you hear that she held his nose and decided to pour the cocoa down. When you do this, instead of the cocoa to go into the stomach, he's struggling to breathe because he's closed his nose, struggling to breathe. Food will end up going down the wrong passage. Air that's supposed to go into the lungs has now become food going into the lungs. And anything other than air in the lungs is an irritant to the lung. So usually, to differentiate from other things that will cause this difficulty breathing, there's always a trigger that's something that always happened right before it. So either you were feeding him, or maybe he took something poisonous and you decided to give him palm oil, and then he vomited then right after. So these are the typical things that you use to differentiate between the aspiration and any other cause of